Welcome back, everybody. This is Food for Thought, Thoughts That Fit For You by Gentrics. Now, in the last episode, we were basically covering the different kinds of birth controls, their effects, and what they do. We're going to pick up with that with the next topic, which would be an IUD. Okay? Like I mentioned in the last episode, it has a 99% effective rate. It can cost up to $1,500, but it can also be zero depending on your insurance. And the thing is with this one is it can only be put in by a doctor or a nurse. So you can't exactly do this one yourself. The good news is, unlike the previous unlike the last one that can also be put in that has a high effective rate or low maintenance cost, the birth control implant, the IUD lasts up to 12 years, whereas the implant lasts up to 5. Okay? And unlike the implant, the IUD, which is a tiny device, it goes inside your ureter to prevent pregnancy. Okay? Like I said before, it is long-term, but it is reversible. It's one of the most effective birth controls that are out there. Now, granted, since it's not a serum or anything specifically like that, you don't have to worry about anything being injected into your bloodstream for this one. First things first. I'm pretty sure you want to know what IUD stands for. Intrauterine Device is what it stands for. It's basically a device inside your body. Okay? Most people remember it as T something. But anyway, like I mentioned before, it's this device, there are 5 different brands, okay, that the FDA has basically approved in the United States. One of which is Paragard. The other one is Mirena, Kyleena, Liletta, and Skyla. Now, to my surprise, apparently all of them are named after girls, but again, I don't really know many guys who actually use them. So, the IUDs, though, are divided into 2 different types. Copper IUDs, which is basically the Paragard and hormonal ones. The Paragard one is the only one that has copper in it. The hormonal IUDs, which would be the Mirena, Kyleena, Liletta, and Skyla, don't have copper in them, and to my knowledge, anyway. Okay. The Paragard doesn't have hormones. It's wrapped in tiny bits of copper, and it can protect from pregnancy up to 12 years. The other 4 use hormone prostogen to prevent pregnancy. The prostogen is very similar to the hormonal progesterone that your own body makes naturally. Okay, Mirena will work up to 7 years. Kyleena will work up to 5. Liletta will work for 7, and Skyla will work for 3. And while the other one does work a little bit longer, it can cause a bit of issues with overages of copper in the body. Okay, both the copper and hormonal ones prevent pregnancy by changing the way the sperm cells move so that they can't get to the egg. And as I mentioned before, no sperm cells, no egg, no pregnancy. It's as simple as that. Okay. The Paragard uses copper to prevent pregnancy. The sperm doesn't like copper, so it makes it almost impossible for the sperm to get to the egg. The other one uses hormones to thicken the mucus that protects the egg, therefore trapping the sperm and making it so that they can't reach the ovaries. Works out well. One of the awesome things about the IUD is that it lasts for years, but they're not permanent. So if you decide you want to get pregnant and you don't want to have it anymore, you can just ask your doctor to get rid of it. Okay? Another thing I want to go ahead and point out. IUDs can be used as emergency contraception. Well, specific ones anyway. The Paragard copper IUD works very well in an emergency contraception situation, but it has to be put in within 120 hours or 5 days after your last episode of unprotected sex. It's more than 99.9% effective. It's actually the most effective way to prevent pregnancy after sex if you're worried about it. Though, keep in mind, you still don't want to have to try to run that risk. I would still recommend using condoms and such anyway, unless you're allergic to what they're made of. and having an extra set of the morning after pill immediately for use. Keep in mind, you have to use it within 2 to 3 days if you're using the morning after pill, just to be sure for it to fully work. Okay, the effectiveness of the IUDs are pretty effective, more than 99% effective, which means 1 out of 100 people who use them will get pregnant every year. And while they claim that they're so effective, there's no chance of making a mistake, you can never be 100% sure. Keeping in mind, though, you still can't forget the pill, like I mentioned before, or the use of condoms. But unlike condoms, you're protected 24/7, constantly. Okay. Another thing I want to definitely point out is that IUDs can't protect you from STDs, so you still are going to have to use condoms and other things as well to help protect you from that. Okay. As far as IUDs are concerned, there's only a few places you can get them, okay? You have to get them put in by a nurse or doctor or a healthcare provider, which means you can only get them from a gynecologist, family planning clinics, or local Planned Parenthood's health centers, okay? As far as what the insertion is like, and I know a few people are going to probably ask me this, first your doctor will ask you some questions about your medical history, then they'll check your vaginal, cervix, and uterus areas. They may also test you for an STD, because if you have one, it makes this whole thing pointless. You may be offered medicine to help open and or numb the cervix before they can put it in there, otherwise it may hurt. To put it in, the doctor will have to put a speculum, you're going to have to look that one up, I will not give the definition to that, into your vaginal area, and then use a special inserter to put the IUD in through the opening in your cervix into your uterus for that to make effect. The process usually takes less than 5 minutes, so it doesn't take very long. And they can be put in at any point in your menstrual cycle too, so you can usually get one put in right after giving birth, or in some cases, despite my dislike of this, abortion. Now, do not get mad at me for saying that. Not everybody's up for abortion, not everyone's pro or for it, okay? I just happen to be one of those that doesn't care. Alright. So, how does it feel to get one put in? People usually feel some cramping or pain when they're getting theirs in place. The pain can be worse for some, but luckily it only lasts for a minute or two. And for some doctors, they tell you to take pain medicine before you get the IUD to help prevent the cramps as well. They also might inject a local numbing medicine around, your cervix area just to make you comfortable. Unfortunately, some people may feel dizzy during or right after it's put in, and there's a small chance that you'll faint. So keep that in mind. You might also want to ask someone to come with you to the appointment so you don't end up driving home. That's definitely something you don't want to do. Okay? Now, after it's put in, a lot of people, they'll feel fine right away, and but they'll still need time to take it easy. There may be some cramping, backaches. You want to chill at home, curl up and watch TV, read a book or something. Get a heating pad or over-the-counter pain medicine to ease with the cramps if you have those. Okay? You may have cramping and spotting from the IUD, but this will only last for a few months. It'll go away. Okay? And thus the whole point of the pain medicine. On the flip side, copper IUDs can make your periods heavier or worse, so keep that in mind. It also can make the cramps worse depending on your body as well, and for some people this goes on over time, or if it starts causing you pain and discomfort, or there's side effects you don't like, you definitely need to call your doctor immediately so they can have it removed. This chances are you're having an allergic reaction to it or some other reaction to it. Okay? And on that note, it's only 1 inch to 2 inches long, so it's not like it's all that far in there, okay? And don't worry, they have a string that's attached to that's also 1 inch or 2 long so that they can take it out, okay? The string is there so the nurses and the doctors can remove it properly, okay? You can feel the string by putting your fingers inside you. That's as far as I'm going to go with that sentence. But don't ever tug the string, because you could move the IUD out of place or accidentally pull it out, and if you do, you run the risk of not only hurting yourself, but you also well, you get the idea. I think I'll leave that as alone. I don't want to go any further than that. The very small chance that your IUD does slip out of place, it can happen at any time, but it is more common during the first 3 months when it's placed in there, and are most likely to come out during your period, so be very careful. You have to check your pads, tampons, cups, whatever you have, to see if it fell out, so keep that in mind as well for those who have heavy periods. You can also check the string to make sure it's still there. If the IUD falls out, you're not protected from pregnancy, so you need to see your doctor immediately. That's the whole point of still using condoms, okay? And remember, when you got your IUD, write it down, keep track of it, so you can have it replaced after 12 years, or unless you have one of the other ones, so 7, 5, or 3 years, regardless, okay? And the thing about it is, you can have sex almost immediately after it's put in. Though I wouldn't recommend it, seeing how you don't know how your body's going to react to it. Okay? And we're back. Question. Can you get an IUD? Well, most people can use IUDs safely, okay? But there are some conditions that make side effects and complications more likely, in which you still need to talk to your nurse, okay? Let me go ahead and say this, okay? Here's where you may not be able to get one. If you have certain STDs or a pelvic infection. If you think you may or may not be pregnant, which should be an obvious one, but, I digress. Have cervical cancer that hasn't been treated, or have cancer of the uterus. That's actually really bad. Have had pelvic infection after either childbirth or an abortion in the past 3 months. Okay. If that's the case, or here's another one for you. You should definitely not get the Paragard IUD, like I mentioned earlier, which has copper in it, if you have a copper allergy or Wilson's disease, or in some people's cases, a bleeding disorder, such as people who have, what's the word I'm looking for here? Sickle cell. If you have sickle cell, especially people who are anemic, this is definitely not something you want, okay? Any kind of disorder that makes it hard for your blood to clot. I can't speak today. And you shouldn't get a hormonal IUD if you've had breast cancer. Definitely not, okay? Very rarely, the size and shape of someone's uterus makes it hard to place an IUD correctly. But if you have any kind of special condition that rules you out, you don't have to worry, okay? There's plenty of other options that you can choose from, okay? So, with that being said, what are the risks? Okay, there are possible risks with IUD, but serious problems are really rare. Like I mentioned before, the IUD can definitely slip out of your uterus, so you have to be very careful that you can still get pregnant. If the IUD comes out part way, it has to be removed. Keep that in mind. Okay, it is possible, though extremely unlikely, to get pregnant even if the IUD is in the right position, right spot. If you get pregnant, you should have the IUD removed as soon as possible, as soon as you find out, actually. Because if you get pregnant with an IUD in place, there's an increased risk of ectopic pregnancy, which is a very serious matter. I actually think I should probably cover pregnancy at some point, but we'll see. It is possible to get an infection if bacteria gets into the ureter when the IUD is put in. So if the infection isn't treated immediately, it can get worse or cause issues affecting pregnancy in the future should you choose to. Basically, when it's put in, it could be... one other thing. If when the IUD is put in, it could push it through the wall of the ureter. This actually sounds painful, but it doesn't usually hurt. But if it does happen, you'll need surgery to remove it. And while this is rare, it's a very big problem. Warning signs that you definitely should be aware of. It's very important to pay attention to your body and the signs as well as how it feels. Here are some warning signs to watch out for, and you need to call your doctor or nurse immediately if you have any of these. The length of your IUD string feels shorter or longer than it was. There's a problem there. It's probably not in place. You can feel the hard plastic bottom of the IUD coming through your cervix. I don't even have to explain how that is. Next, you think you might be pregnant. That's understood. You have bad cramping, pain, soreness in your lower belly or stomach. There's pain or bleeding during sex. Keep that in mind. You get unexplainable fevers, chills, or having trouble breathing. Your vaginal discharge is different from normal. You have vaginal bleeding that's heavier than usual. If you have unprotected sex with someone who happens to have an STD, definitely go see your nurse or doctor for any tests or treatments you may need immediately. And yes, while I'm mentioning all of this negative, tragic stuff, it is still safe for breastfeeding, so you don't have to worry about your kids, okay? Now, something I want to definitely go into before I finish this up, there are disadvantages to a hormonal IUD, okay? Some people will have side effects after getting a hormonal IUD, okay? They usually go away about 3-6 months later after you've had it, okay? Because that takes that long for your body to get used to the little visitor in your uretus. If you stick it out for a few months, there's a good chance that the effects will ease up or your body will just get used to them. The side effects may include pain when the IUD is placed or cramping or backaches for a few days after, spotting between periods, or just straight up irregular periods. Over-the-counter pain medicine can help with the cramping, but if the bleeding and the cramping doesn't get any better, you need to go talk to your doctor. And again, like I said before, it can protect against pregnancy but not STIs, so keep that in mind as well. The non-hormonal ones, which would be the copper one that I mentioned before, the side effects for that one would be the pain when the IUD is placed and cramping from the back or backaches, again, for a few days. Same thing as before, spotting periods, irregular periods, or two new ones with the copper one, heavier or longer periods or cramping during your periods. So again, if you experience any of these issues, you definitely want to go see a doctor immediately. Okay, so that's it for the IUDs. We're going to take a short break, and then I'm going to come back and talk about the birth control vaginal ring next. partner, they can help remind you to remove it and change it out. Keep your replacement rings in the same place so you don't lose them, and store them at room temperature and away from direct sunlight for up to 4 to 16. If that's not the right one, I do believe that's the one. Certain HIV medicines, I won't go into that. Certain anti-seizure medicines. So if you're on anti-seizure medicine for whatever reason, or you're bipolar and you have bipolar medicine, those will nullify this ring's effect. It won't do anything. Another one will be the herb St. John's wort. I'm not going to go into what that is. Okay, I'm pretty sure there's people out there who knows what it is. It's a type of drug / plant. And I'm pretty sure weed addicts definitely know what it is. Okay, I'm not assuming that all of them do. But if you're taking any of these, you need to use a condom as well as the ring just to make sure. Or switch to a different birth control method altogether. Okay? Your doctor or nurse will help you decide for whatever reason if this one doesn't work for you. So keep that in mind. Alright? And just to throw this out there, the ring is easy to use. You insert it in your vaginal area once a month, okay? You can choose to get periods every month, or you can skip them. It's, up to you. There's different sites to learn that tells you how to do this. First things first, make sure the package on the expiration date on the package for the ring hasn't expired, because in this case, the material that it's made of will start breaking down. In which case, one of two things can happen. One, it'll do nothing, but it won't protect you. Second, it'll poison you.